Hello and welcome to another episode of Hornbill TV's Health Talks, where we bring healthcare professionals, doctors for expert insights into your health and well-being. Today we'll be talking about kidney donation, kidney transplantation and more. And today we have with us Dr. Varun Mittal, who is the head of kidney transplant and associate chief uro-oncology and robotic surgery at Artemis Hospital, Gurugram. Now, Dr. Mittal is visiting Dimapur for an exclusive in-person consultations, and today he'll be shedding light on kidney transplantation, kidney donation and beyond. So stay with us. So hi doctor, and thank you so much for joining us, and welcome to Hornbill TV.
Thank you.
We're so happy to have you here today. So doctor, today we'll be talking about kidney transplantation, kidney donation. So we'll be dividing into two parts. In the first part, we'll be talking about kidney donation, and in the second part, we'll be talking about kidney transplantation. Yes. So to start off with the basics, doctor, who can be a kidney donor, and what is the age limit? Like, can a teenager, can a 17-year-old or a 72-year-old as well donate a kidney?
So the age limit is from 18 to 65 years. Below 18 cannot donate. Above 65 years, we generally take donors in special situations only. If the donor is fit to donate and if that kidney is good for the recipient. Only in those situations where less than 65-year age donor is not available with the family. Otherwise, the recommended limit is from 18 to 65 years of age.
Okay. So can someone with high blood pressure or diabetes, donate a kidney? And also, what other health conditions may prevent this donation?
So the first thing important is that in a transplant program, donor is more important than the patient. So we do not want the donor to become a patient. So the idea is, by donating kidney, the donor should live as normal as life with one kidney, and that kidney should give good dialysis free life to the patient. So the most common diseases which cause kidney problem are diabetes and hypertension. So any donor who comes forward for donation, if they are already having diabetes and hypertension, they are outrightly rejected. They are not taken up. Only in very few special exceptional cases where like the transplant is utmost necessary for the patient and there is no other donor available in the family, and the donor is having like recent onset diabetes or recent onset blood pressure which is very much controlled with one or two drugs, and the blood pressure and diabetes has not affected the kidneys and other parts of the body yet. So we do some screening tests, see whether it is good to go or not. If those screening tests are okay and we find the current state of diabetes or hypertension, if it is well maintained as it is now and it is not going to affect the future to the donor, so then we can take up. It's only in very few exceptional cases.
Okay. So supposing I'm the only working one in the family, so will I be eligible to donate?
Yes, that again the same thing, like we screen the donor first with few tests. If you are fit enough to donate and you can lead a normal life after donation of the kidney, and we are not expecting any disease in future in you by donating the kidney, then why not?
Okay.
Then it is not the problem if you are working.
Okay. So doctor, you specialize in robotic kidney transplant surgery. So what is it all about? Can you tell us more about it? And is it a better option than the old traditional method?
So like most of the surgeries initially when they started as open surgeries, be it kidney surgery or any other organ surgery. So these open surgeries were like more morbid operations. They have like large incisions, they were painful, the blood loss was more, and it was not cosmetically appealing. So slowly and slowly the minimal invasive surgeries came up, where we do laparoscopic surgeries and the scar size is low, small incision small, and the pain is less, and the early recovery and small hospital stay. So nowadays after laparoscopy, robotic surgery has come up, in which the surgeon sits on the console and do the surgery, and there is a one bedside surgeon with the patient. So these are kind of minimally invasive surgeries which give good benefits to the patient in terms of small size, less pain, less hospital stay and early recovery. So kidney transplant is also one of the surgery which can be done with robot, and in few cases, like the patient is having morbid obesity for example, and the abdomen is large, in that case if we give a large incision, the high chances of having wound infection. So because that in transplant surgery we give immunosuppressive medicines which in which there is a very high chance of getting infections, and wound infection is one of those infections which can be sometimes fatal also, especially in diabetic patients and obese patients. So if we can use a method which can in which there is a small incision, so it prevents wound infection to a large extent. So robotic surgery is a small incision, so it carries good benefit in patients who are obese. But as such, if you ask in general, robotic surgery or open surgery, which is gold standard, most of the steps are similar. Nowadays, the open surgery, we have devised some different techniques where we do surgery with a small incision, where similar benefits of robot can be given in open surgery as well in thin built patients. So at the end, I would again say that robotic surgery gives advantages only in few selected obese patients if we talk about the cosmetic or wound infection part.
Okay. So is it accessible or practical for patients here in Nagaland?
Like some patients do come directly, they want open surgery, they do not want a big incision. They want robotic surgery. Then we can, it can be offered in any kind of patient. But if I feel like this robotic surgery will just add on to the extra cost and are not going to give benefit to the patient, so I can counsel that patient कि you can go ahead with open surgery with similar kind of results, or it may be better results. So it depends upon the situation. Sometimes we offer the patient, like in your case, robot will definitely benefit in your case. So that is the situation.
Okay. So how long does it take to recover after the operation?
So normally the hospital stay, total hospital stay is around 7 to 10 days in the hospital. But in case the patient is recovering, we tend to discharge by 6th or 7th day. Okay. So mean hospital stay is around 5 to 7 days.
Achha. So after that period, the patient will be able to lead a normal life, like doing sports activities, yes, or any outdoor activities.
So
right?
any kind of work which the patient was doing before transplant or before getting onto dialysis, they can venture any kind of work after 6 to 8 weeks of recovery. Like for example, if you can, you are asking for sports activity, like if somebody is a badminton player, then he or she can start playing the sports around 8 weeks or 12 weeks after the surgery. For initially 8 to 12 weeks, we just give instructions to be start slow because there is risk of some infections. As soon as the after 3 months, the risk is very less. If the patient takes basic precautions, then there is no risk. So any kind of activity, any kind of office work, any kind of field work can be started after 8 to 12 weeks of surgery time.
Okay. So are there any long-term effects like after donation? Like, do I have to follow certain medicines or regular checkup with a doctor, or maybe what will be the risk after I donate my one kidney?
Yes. So as I already said, the screening test has to be okay, so that it is safe to go for donation. But anyways, so in first 3 months, like we ask the donor to do not lift heavy weight. Otherwise, the routine household work and office work can be started. And in long term, we usually do one health checkup at 3 months after surgery, and then ask to follow up every year for basic health checkup, so that we just know that every parameter is okay, hemoglobin is okay, creatinine is okay, urine parameters are okay. Sometimes donors tend to forget or do not come because of many reasons, and they do not go for any checkup. Like most important is just go check creatinine, urine routine and blood pressures and sugars every 6 monthly or 1 year, so that the patient is not developing any blood pressure or diabetes which may affect the one kidney. And we also give advice regarding the food habits, so that because like simple like salt intake. So the salt is one of the culprit of having high blood pressure. If there is a high salt intake, high blood pressure, it may indirectly affect the kidney, and the donor which is having only one kidney may end up in having kidney failure. So these kind of regular checkups are just to make sure everything is going right, donor is following the precautions, general precautions, even if the donor is not becoming the donor, and we just give what healthy advice is given to all patients by any doctor, that he or she should follow. And just most important is one yearly health checkup.
Okay. So doctor, recently I read about this cadaver organ donation, and that one person can save lives of 8 people after donation. So can you tell us more about it, and what is the process of organ pledge?
Yes, cadaver organ donation, like more than 3 lakh patients are waiting for organ transplant in our country right now. So, and from out of 3 lakhs, like more than 2 lakh patients are there for kidney transplant only, because the incidence of diabetes and hypertension is rising in India. Is kind of diabetes. India is diabetes capital of the world. So the incidence of kidney problems is also rising. So right now, if we see in a year, 1 year data, more than 2 lakh patients of kidney failure are waiting for kidney transplant, and we are, as a country, we are able to do around 15,000 transplants in a year. So like you can see the gap between the demand and the supply. So the cadaver organ donation is one of the method to increase the organ donor pool. Like initially the transplant started as a live related kidney transplant. Then because of the donor problem, we started swap kidney transplants, and then even now the blood group incompatible transplants are also happening. But even then the demand is more. So if a cadaver who is brain death donor, like for example is a road traffic accident and there is a brain injury, and that patient goes to the hospital, and the doctor sees that the brain injury is now irreversible, the patient is not going to recover anyhow. So but the other organs are in good shape now. The heart is working well, kidney is working well, liver is working well, eyes are okay. So this brain death donor, who is otherwise the end result is, we know he or she is not going to survive, then why not the organs which are in a good shape can be transplanted to the patients who are in need, so that we can save life of them. So like one cadaver can donate like 2 kidneys, 1 liver, both eyes, lungs, pancreas, so that more than 8 patients' life can be saved. So in our country, still the live related program is very strong, and it is getting more stronger, but the people are not aware about this brain death donation concept, cadaver organ donation concept, and it is our duty to make them aware. If like I am going to die anyhow, then why not I should donate, so that other person can live long. So there is a thing called as organ pledge. You can pledge your organs or tissues as well. So there is a difference between organ and tissue. Organ is like kidney, liver, lungs, pancreas. Tissue is like cornea and skin. So there are many burn patients who are more than 80% burn, and they need skin for reconstruction. So you can donate your skin after your death. So if there is any mishappening at that time, if you have already pledged your organs, your family would know that he or she is an organ donor. So then they can inform the hospital treating team that if you want, then you can retrieve the organs, so that it is benefit to the other patient. So organ pledge is now very easy. You can go to the National Organ Tissue and Transplant Organization website called as NOTO, where you can just put your phone number and Aadhaar card. There is a scanner also, QR code scanner. You just scan, then the window will open, where it just name, age, phone number and Aadhaar number. Then you can have a choice of donating organs only, or tissues only, or whole body. Like even the body can be utilized for teaching purpose in medical colleges, anatomy dissections and there is. So these kind of donations you can yourself pledge, and then you will get a donor card from Noto. That donor card you should keep in your wallet, and you should also inform that everything to your family, so that in case of mishappening, this organ donation process can be done, and we can save life for more than 8 patients. So in nutshell, this is the story. Nowadays, even after cardiac death, we can retrieve organs within 1 or 2 hours of the cardiac death. So death is not the only thing, everything has stopped. So there is death, well, I would say in general terms, first death and then final death. First death is like brain death. The brain is not functioning, irreversible damage to the brain stem. So this person is not going to survive anyways. So then why not to donate?
Even the eyes.
Yes, there are many factory workers where they get eye injuries, coal mine workers and many. So incidentally they get injuries to the eye and they get permanently blind. So cornea transplant can be done. So if the cornea, they take cornea within 24 hours and then this cornea is preserved in the eye bank, and then this is transplanted to the patient who is on the waiting list. Like for example, one eye is damaged. So there are few eye banks in our country where this cornea is stored. So I will tell more. There are few models about brain death donation. India is the 3rd country in the world in the number of transplants per year which are happening. But in donation part, we are doing mainly living related transplants. We are not doing much of brain death, cadaver organ transplants. But in Spain, the thing is like more than 99% donations are from cadaver organs. The living related transplant is not that strong. Even in America, mostly donations come from cadaver organs. The living related transplant is not that strong because the people are more aware. So if we can create awareness in our areas, so more and more public should come forward, so that we can save lives of the patient who is anyways on dialysis or having liver failure or having blindness.
Okay, so like after somebody donates his or her organs to other patients, like what will the family benefit out of it, or are there any benefits?
So no, there's no benefit in the sense of like giving, like if your donor has donated the organs, but anyways, like government has given the priority list. If somebody in the family has donated organs, so if there is patient in that family, so that patient will get benefit in the terms of waiting list. Like somebody is having kidney failure in that family, and they have registered for cadaver organ transplant, and if the family member has already a brain death donor, cadaver donor, so then they will get appoints on the waiting list. Otherwise, as such, there is no benefit which we are providing, or government is providing to the patients.
Okay, so now we'll be talking about the kidney transplant process. So in simple terms, doctor, what is kidney transplant, and how can people identify the early signs of kidney diseases, and when should they start considering transplant as an option?
Like any patient, there are 2 kinds of patients who are already having diabetes or blood pressure, and they are on regular follow-up of a doctor, and because these are the most important conditions where the kidney failure may happen in future. So their regular checkup and is very important, and if they are progressively having kidney failure and the creatinine is rising, so then the kidney specialist who are they under follow-up, they will advise accordingly. Secondly, like the early signs of kidney failure are like the blood pressure is getting more and more, and it's not getting controlled with regular medications. The loss of appetite is there. There is some amount of swelling which is more in the morning while the patient wakes up around the eyes, or there is a swelling in the feet. The urine output is not good as it was before, and the patient is feeling weakness, fatigue, and not able to work in office. And there are like few scratch marks on the kidney. He or she is having itching all over the body. So these are kinds of the signs, early signs, where we can say this patient is maybe having higher creatinine or high urea. So then immediately should check serum creatinine levels, urine routine, and urine protein levels. So if there is sign of kidney failure, immediately he or she should consult a doctor so that early treatment can be started. So these are the early signs of kidney failure. Second, like slowly and slowly the kidney failure progresses, and there are like 5 stages of the kidney failure: 1, 2, 3, 4. So and 5. The 5 is the last stage, called as end stage kidney disease, where the patient needs renal replacement therapy. The renal replacement therapy is like dialysis or transplant, so that we are replacing the kidney function with some technique which can take over the kidney function. Like dialysis machine can handle that functions of the kidney, and otherwise the next option is kidney transplant. So early signs of the kidney failure, going to the doctor timely, third stages of the kidney failure, and then in last stage we are having 2 options like dialysis or kidney transplant.
Okay. So, doctor, many patients in Nagaland, they rely on dialysis in the nearby hospitals. So, what is the long-term effect of staying on dialysis, and is transplant better than staying on dialysis?
So, like we are talking about 2 modalities. One is dialysis and one is transplant. Like in dialysis, initially it has to be it starts with twice a week, or then it finally advised as thrice a week dialysis. Like for example, just suppose a 25-year-old young man who is earning member of the family, and now he is having kidney failure and started on dialysis. Like if he is supposed to go 3 times a week, Monday to Wednesday and Friday, on the day of dialysis he or she cannot go to the office. Like at least 4 hours of dialysis is needed, and then after that next day he will feel weakness. He is not able to work properly. So you can say the whole week is gone. So he is not able to contribute to the his work, and also not able to contribute to the family. And he is now, on the other hand, he is spending on his treatment. So the quality of life is not good, and secondly, he is not able to contribute to the finances of the family. And if he or she is married, and then he is not having good family life or any other kind of life, you can say. So overall, dialysis is not providing the good quality of life, and draining in all the terms, like health wise and as well as finance wise. The patient is having persistent anemia, they have bone disorders on long dialysis, they feel weak, they are not able to work. The dietary restrictions are very there, and they are supposed to take many medicines, and the medicines also give some side effects. So for a young patient, these are the problems. Finally, the person who is accompanying with him for dialysis, there is also the loss of work hours for that person. So we are talking about the 2 person now. On the other hand, if this patient, young patient, 25-year-old young man who goes for transplant, so that is a one-time treatment. It gives good productive quality of life. The dietary restrictions are not there. There are few medicines, and can work, can earn, having good family life, having good reproductive life. So these kind of advantages are not with the dialysis. So but there is other situations. If we talk about like 75 years old man or woman who is having end stage kidney disease but not fit for transplant, in that case obviously they have to depend on a good quality dialysis. So I am not saying that dialysis is bad, but we have to see the situation. For younger patients, transplant is the best option because it gives good productive quality of life. But if even in old age, if the patient is fit for surgery and he wants to live, then why not? So there is no as such age limit, but if patient is fit for surgery, he or she wants to live, even then we can offer transplant as a first choice. Dialysis is not like a cure, it is just a control of that kidney function for the time being.
Okay. So doctor, kidney stone formation in the kidney, how does that happen?
So there are many causes for kidney stone. First is there is no cause as such. Second is dietary habits, like the fluid intake is not good, salt intake is very high, sugar intake is very high, and secondly animal protein intake is very high, and there are some special like green leafy vegetables or dry fruits or animal proteins. So if the intake of these is very high, then the tendency to form stones is more. And there are some special situations where like patient is having metabolic problems, hypercalcemia, hypercalciuria, hyperuric acid, in high levels of uric acid in the body, maybe due to dietary or there are some other causes. And there are some genetic problems, the disease runs in the family, where the patient is, the dietary is not a contribution, but the other problem is the genetic part is contributing the formation of recurrent stone. The patient is getting the stones in both the kidneys again and again and again. So slowly and slowly these stones, if are not taken care timely, they can affect the kidney function and ultimately may lead to kidney failure. There is one condition called as primary hyperoxaluria, where the problem is with the liver, with the oxalate metabolism. The oxalate goes very high and then it forms stones in the kidney, and slowly kidney gets knocked down and patient is having now kidney failure. So in that case, sometimes the patient comes early, so then the treatment can be done. But if it is if he or she comes in the very late stage, then patient needs both kidney and liver transplant as well. So I mean to say that like dietary habits, and second lifestyle habits, third is family history of genetic problems. These are the three causes of kidney stones.
So doctor, I just wanted to relate one incident that happened to me when I was in my 7th standard. I had a severe pain in my abdomen and I was finding it difficult to urinate. So it was very painful. So I told my parents and they gave me a medicine in a liquid form. So after I took that medicine, roughly maybe around 2 days, after 2 days or so, I was just casually walking with my friends, and then suddenly I sort of hiccuped, and at that moment something like a saliva or food watery substance came off, and then when I spat it out, there was a stone that came out from my mouth. So it was very surprising for me as well. So I just wanted to narrate you that incident. Like, is it even possible for a stone to come out from through the mouth? No. Or is it related to kidney? Or
no, it's not related to the kidney. It may be something else, and you must have some like something in the food which was like a stone or some like there are some pricks, scale like things in the fish as well, so which sometimes comes out of the stone. But this is not the thing like the stone in the kidney can come out from the mouth. It is not like that. It should come out from the urine only.
It was very difficult to urinate and sort. So, but I never went to the doctor.
Incidentally, you may be having both the problem. Like you may be having some urine infection as well and some stomach problem at the same time, and you just correlated that thing with that thing.
Okay. So, doctor, what is the right time and age for getting a kidney transplant?
So, as such, whenever the patient is into kidney failure, the kidney transplant can be done. There is no as such age limit. We do transplants in pediatric age group as well, like 5 years, 6 years, 7 years old children, and even we can do transplants in 70s or 75 years of age. The only thing is that patient should be fit for kidney transplant, and there should be indication for kidney transplant.
So, what is the success rate of kidney transplant? Like, how long does a transplanted kidney stay inside the body?
So nowadays the success rate is very high, like more than 90% of the kidneys survive for more than 5 years. And there are different categories of kidney transplant, like blood group compatible kidney transplant, blood group incompatible kidney transplant. So success is more or less more than 90% if the all the parameters are okay with donor and the patient.
Okay. So doctor, if someone's kidney failed due to PP or diabetes, is there a risk that the new kidney might fail too?
So like this is a very common question, like patient ask, I am diabetic and now my kidney is failed, and now if I get a kidney transplant, new kidney will also get failed. So this is not the situation, because initially you were diagnosed late about the uncontrolled diabetes or uncontrolled blood pressure, and then you did not take regular medications, you were not into regular follow-up with your doctor, so the treatment was not good and at the right time. So that affected your kidneys. But now you already know that you are having diabetes and blood pressure, and now you know everything. If it is not under control, obviously it will affect the new kidney. But because you are knowing everything, you will take care better. You will be in a regular follow-up, under regular checkup. So the very less chances like this blood pressure and diabetes will affect the new kidney in a short term. Obviously a small amount of effect, but you will live good amount of years with diabetes and blood pressure and with new kidney.
Okay. So doctor, after post-transplant, can a person lead a normal family life, including having children, or a normal sex life?
Yes. That is the difference. I already told dialysis versus transplant. That transplant provides a good family life, reproductive life and sexual life. Like for example, if we talk about donor, so if a young married female have to donate kidney to the husband, and she asks when we can conceive. Yes. So then they can safely conceive after whenever she is mentally and physically ready for that. So after, like we normally advise after 1 year she can go ahead with pregnancy. And in case of young males, the sexual life is also very much improved after the transplant. So because the overall stress levels are very low, the medications are not that much, and the patient is able to patient is more physically fit, patient is independent, and they starts earning. So overall the stress level is very low, and they perform very well in terms of reproductive or sexual life.
Okay, so doctor, many patients in Nagaland are nervous about donating their kidney even to a loved one. So how do you help patients feel safe on that?
Yes, so we regularly, whenever the whenever the patient of kidney failure comes to our OPD, so the family always asks, कहीं से kidney दिला दो, हमें kidney कहीं से नहीं मिल, can we get kidney from somewhere else? So they are always afraid of donating kidney. So we counsel them again, like for the donor is more important than the patient, and we will screen very well if we know there is no risk in donor after donating, and then only we will take up. And sometimes we also let them meet the old donors, so that they have good confidence in them. If they are doing good, then obviously they will also do good. And for patients as well, we counsel, we give both the risks and benefits of both dialysis versus transplant, and what benefit transplant can add to their life. So after that they usually decide, and then if after a good counseling, usually family comes up, and then if initially there are no donors, then they come with 2 or 3 donors.
Okay, so doctor, what are the costs involved during and even after post-surgery, and are there any government schemes or insurance policy that cover?
So the transplant program runs in 2 kind of setup, like government setup and private setup. So nowadays the government setups are also increasing and the private setups are also increasing. More and more standard setups are now being are doing transplants. In talking about the government, there are few schemes by the government, like you can say Ayushman Bharat scheme, where patients can get enrolled in the hospital where the transplant facilities are there, and the Ayushman Bharat scheme is available, and then they can get whenever the waiting list number is there, they can get the transplant done. and there are packages under the Ayushman scheme. This Ayushman scheme is also available with few private setups as well, and then cost can be more or less, the cost can be taken care by the government. But secondly, in private setups also, because the demand is more, so the cost is not erratic. So the most of the people are able to get the transplant done in that cost. Normally, like if we talk about our setup, like in if the blood group is matching, like more or less the tests are okay, and the workup is okay, both the patient and donor are fit for the surgery, and then mostly patients end up having transplants in around 7 to 8 lakhs of expenses. And after that, there is like month-wise medicine cost, which they can like initially 3 months it is more, and then slowly there are few medicine which will stop, and at the end of the 1 year, like they have to spend around 3 to 5,000 per year per month for having the regular checkups and medicines.
Okay. So, doctor, lastly, do you see any potential for more collaboration or outreach so that the people from here, from Nagaland?
Like outreach is very important for the transplant patients, because every patient sometimes not go to the hospital, and if the outreach program can be made stronger, then the patient can discuss freely with the doctor regarding the risks and benefits involved in the transplant. And like in Nagaland also, the incidence of kidney problem is increasing, and more patients need transplant. And if we are able to build a strong outreach program, so that a regular outreach program where the patients can come and discuss, and then they can decide, that would be obviously benefit for the patient.
So, Doctor, when will your next visit to Nagaland be?
I am trying to make it every second or Friday or Saturday of every month.
Okay. Okay. Any last message that you want to give to the people of Nagaland?
I just want to give a message, like any young person who is having family history of diabetes or blood pressure should be very much aware of getting the kidney problem at early age. So any person who is having family history, they should get themselves screened every year. They should get a health checkup done by just simply doing serum creatinine, hemoglobin, urine routine and urine protein test. Secondly, if the lifestyle is sedentary lifestyle, make yourself more active, exercise daily, drink good amount of fluids, do not have much of salt, sugars and animal proteins, control it on that part. Third, if you are a smoker, then quit today and let others quit also. Okay, so the family history, sedentary lifestyle, bad dietary habits, more of salt, sugar and animal proteins, and smoking. So these are killers for the kidney. So if we just take care of them, then we can this is kind of preventive medicine. So we can these are few golden rules to keep your kidney health. Stay fit, do some exercise daily, good amount of fluids, and just get health screening every year.
So thank you, doctor. So that brings us to the end of today's session at Health Talks at Hornbill TV. Heartfelt thanks to Dr. Mittal for his time, for his wisdom, for our people here in Nagaland. And yes, remember, Dr. Mittal will be here for in-person consultations. He'll be visiting Dimapur next month as well at Isabel Physiotherapy Clinic near Dr. Behlo's Hospital. It is in Welford Road, Dimapur, Nagaland. So that is all for now. For more news and updates, keep watching Hornbill TV.